today to the Low Carbon City TV, LCCF TV, to a hangout with a really nice array of speakers. Our motto and our topic today is called An Agenda for Air Pollution Monitoring. And my name is Florian. I'm very happy to welcome four speakers or participants to this hangout. Nandita Murukutla, she's the Director of Global Research and the Country Director for India from the NGO Vital Strategies. We also have Dr. Jessica Lewis. She's a consultant at the World Health Organization. We have from Sao Paulo, Brazil, we have Thiago Hérick. He is also a PhD in the Department of Nutrition, School of Public Health at University of Sao Paulo. And we have David Lissmyr. He's a co-founder of Plume Labs. Hello and welcome, all of you. Let me just walk you through maybe a brief introduction to this hangout. What are we doing here? So our initiative is the Low Carbon City Forum. We are an initiative inaugurated in Medellin in Colombia, but meanwhile active worldwide. Our aim is to decarbonize cities, to create civic momentum and citizens' momentum for creating decarbonization in urban environments. And for that matter, we work with different stakeholders, with different projects, small scale to large scale, awareness creation, international policy feedback, and also urban projects. We will have our first global forum this October, from 10 to 12 October in Medellin, Colombia, where we will assemble about 3,000 participants on the topic of low carbon cities, and the motto is to build creative solutions, build collective solutions. And today we are dealing or talking about a topic that is very closely related to climate change, to emissions in general, which is the health-related aspect of the way we basically put emissions up in the air. It's air pollution. We are working more and more on this topic because it's an interesting intersection between dealing with climate change, and also urban health, and it directly affects us. So we had a previous discussion in May, also on the topic of air quality, of air pollution, with speakers, where we basically saw that civil society has a really important role in creating public awareness about air pollution, because air pollution is a problem that we don't really see until it's really bad, but it affects us also in this phase where it's kind of invisible. But then at a certain point, it becomes really bad, and it also needs the pressure from all of us as citizens that things get moving and things can be improved. So today we will not deal so much with what's at stake, what are the health issues about it, but more on how we can monitor or make those problems visible. So for this matter, we have today invited speakers from international organizations, from the private sector, from academia, to discuss how we can collectively follow up on that problem. That means, how can we understand what we are looking at, how can we understand the data, how can we create the data ourselves, how can we ask for more qualitative data, and how can we ourselves become maybe even people that monitor urban air quality or urban air pollution. So let's go around the speakers. We make a small introductory round. We will start with Nandita. If you just briefly introduce yourself, please. Hello? Hello? I think you need to talk again. Yes?
Okay, you can. Hanging out with all of you. No?
No, we hear you now. Please start again.
Okay. I am audible now?
Yes, that's fine.
Thank you. Well, thank you again for having me here. I'm very pleased to be here and to be hanging out with all of you on this issue. I represent an organization called Vital Strategies. We are headquartered out of New York City, but our work is around the globe, mostly in low and middle income countries where we work with governments, civil society, and other actors on emerging and critical public health priorities. A number of these are the health promotion or preventive sorts of areas like tobacco control, road safety, obesity prevention, and environmental health, of which air pollution is a critical part. I'm a behavioral scientist by training, so I come with experience in how humans interact in their environments and how they're affected by their environments and can lead to effective change. So I'm very happy to comment on that as one of the points that you've noted in today's Hangout discussion, Florian. I am based out of India, so I know that that will be an area of interest. So again, happy to talk about any of these. Thank you.
Okay, let's continue with Jessica.
Hi, everyone. It's great to be joining the Hangout today. I am working at the World Health Organization's headquarters office in Geneva in our Department of Environment and Public Health. And here we work on a range of air pollution topics, indoor air pollution as well as outdoor. And so I'm happy to talk about our work in these areas. And I also have a background as an environmental health scientist measuring air pollution myself around the world in indoor settings.
Okay. So let's, I was just, I completely forgot for you to mention from where you're calling. I think, Nandita, you're in Boston at the moment, right?
Yes, I'm in Boston.
And, yes, and Jessica, you are in Geneva?
That's right.
Okay, great. So this is because I wanted to say now we hand it over to Brazil, to Sao Paulo.
Hi everyone, it's a pleasure to join the call and hang out with you on this important issue. I'm Thiago from the University of São Paulo, working on a series of studies trying to understand the health impact of changes in the transport and in the urban planning as well. Well, briefly, what we've been seeing is that moving towards a more compact city or more sustainable transport will also bring benefits for health in places like São Paulo and several other low and middle income settings for which evidence is less available and where the harm is largest. Happy to contribute. Hope we have an interesting conversation.
Okay, so then let's give the word to David Lissmyr.
Yes, hello. It's a pleasure to be on this Hangout. So I'm David. I'm one of the founders at Plume Labs. So Plume Labs is a startup based in Paris, France. We basically try and work on solutions to help citizens better understand the air pollution they are being exposed to, and hence help them actually measure and know what they're being exposed to. So our first product that we developed is an app that basically tells you how air pollution is evolving over your city. But what we're also working on hard right now is the development of small wearable sensors to track the different air pollutants around you, and hence be able to provide people with useful recommendations. So this is what we do, and I have a background, as a background, I'm an engineer, computer science and data engineer.
Okay, thank you very much. I have a question because we had just yesterday actually the International Energy Agency published a report basically stating this number that every year more than 7 million people are dying attributed to premature or dying prematurely because of air pollution. So I wanted to ask Jessica what this if there is a growing interest and a growing awareness in the international community about these issues. So just starting from a large perspective. So what is happening in the debate? Maybe Jessica and also Nandita, you can talk about that. Like, is the international community getting more aware of this? Is there more momentum to be dealing with air pollution?
Sure, I'm happy to talk about this. And these numbers from the IEA report are part of a sign that, yes, a lot of large organizations, a lot of governments are building an awareness and a consensus behind air pollution being an enormous issue that needs to be tackled. At the recent World Health Assembly, a resolution was passed, which is following a resolution that was passed in the last World Health Assembly, in which countries are stating that air pollution is a major issue that we need to tackle for our health. And so I do think that we are seeing a major swing in how governments and organizations are viewing the connection between air quality and health. And of course, there are additional connections with air pollution and climate, but this link between air quality and health is intensifying in the public dialogue, from my perspective.
Okay, is that something what you can share, Nandita? Like the experience that is more pronounced. Are we muting you again, or you're fine? No, I think now we should hear you.
You can hear me? Okay.
Yes.
Yeah, I agree with Jessica. I think we're in a very exciting time. Last year was an important year. The SDGs were adopted. In there, we made the case for health, and we made the case for health in all policies by describing some of the goals in other areas, like whether it was urban planning or energy. So we were starting to see and make the case for how health is in fact something to be considered in all policies. Then came the Paris Agreement and the Climate Change Agreement, which countries really got behind, made their own independent, voluntary targets, and in there also health played an important part in plans. We would wish for a greater role for health, particularly for countries to see the full benefits that they can achieve from implementing certain policies. But it's exciting that the connections are starting to be made, and now we're coming up upon the new urban agenda, where once again we have an opportunity to make the case for health, air pollution, and the many other interventions that are being planned in the name of economic development. So in sum, I think we're in a very good time for health and issues like air pollution, and making this case for how economic growth can be driven while the health of people is safeguarded is really something we need to make clear and known.
Mm-hmm. Is there, Thiago, can you say, I know that I didn't put that question before to you beforehand, but can you, is there some number, because you just mentioned that there is a big economic loss to all of that air pollution. Is there any number that shows us how large this is?
Well, this is a striking number, and it's which also highlights the importance of organizations such as the WHO, which relates to the update for the global urban ambient air pollution database, now last month, that shows that 98% of all cities in low and middle income countries with more than 100,000 inhabitants do not meet the standards. the air quality guidelines that protect health. So this is an unbearable situation. And even if we go to the high-income cities, like we still have 56% of all cities around the world being able to reach the minimum standards. And unfortunately, tackling air pollution is a major issue for all, but it's a really important issue for the poorest, both within cities and across cities around the world. What this data showed is that unfortunately the awareness is high, but the problem is increasing. It's increasing and is increasing more in low and middle income places.
Mm-hmm.
So it was never so urgent for us to tackle air pollution in cities.
Okay, I can read from my Plume app. I can read that we have a moderate air pollution today. Is that how are you seeing the global scale of this challenge, David? Is it for you guys? I think maybe you can tell a little bit how you with Plume Lab started and what your aims are, also to enable citizens with technology. I mean, let's see where do you see your role in this? Like on one hand you have this big list of cities around the world, a lot of the lower income countries and middle income countries have huge problems. They have huge challenges with financing urban change, but there is a lot of citizens that want to engage themselves in urban transformation. So how could technology help here in helping us monitor the situation?
So you were mentioning this app. Actually, so the way we started was really through this application that basically goes and collects the air quality measurements that are being made real time over a few hundreds of cities worldwide, and basically uses that data as a first level of information to then provide predictions and a understanding of how air pollution evolves and will evolve over a city. Now, the big issue we see is actually that in lots of places you don't have any real-time data or close to real-time data, so you actually don't know what the air quality is on many cities worldwide. We also have the issue of people in some places reporting that they are not, when there are air quality readings and reports available, that they don't trust those. It may be right, may be wrong to do so, but at least we hear many citizens saying that they don't trust them. And then the third issue we see is that talking about air pollution over a city is of course one thing of interest, but then air quality actually varies a lot from one street to the other, from one place to the other, and the experience you have as an individual within your city is actually very different from what your neighbor or other people will breathe. And I'm not even talking here about indoor pollution, which is obviously a very different subject, but just the outdoor one. It changes so vastly. And when we look at the situation in Europe and in France where we are, there are over a city like Paris, maybe it's 19 stations that measure air quality. It's an interesting number, but it completely misses the variability and the scale and the granularity of the phenomenon. And so being able to understand my own exposure and hence understand how I can improve what I'm being exposed to and what I breathe is paramount. And we believe that the best way to do that is actually by providing people with a way to actually measure that. And that's where the wearable and the sensor we're developing come into the light.
Okay, thank you very much, because I think that this is really interesting when you take, for example, this the case of Beijing. There used to be only one publicly available air quality or air pollution measurement station, which was on the US Embassy, and this was the only data which showed the situation for the entire city. I think here in Vienna we have I think some like a handful of stations, and I also think that that this is important to understand for citizens when they say, okay, why do we want to monitor air quality? It's in the first place because we want to be able to care well for our health, for the health of ourselves and our families and friends and the people who are around us, and then also empower the communities around us. Make them understand what's actually going on, but then also to have data that is of solid quality at hand to then go to decision makers to also lobby for change or betterment of the situation. So this is the broader, I think, the broader context of this whole of monitoring and air pollution. I was when we dissect this number, this large number of people prematurely dying of air pollution. I think what a lot of times is not talked about is that this is the number for people dying from indoor and outdoor air pollution, because there is this large number taken together, and I think that this is something critical to understand. That there is, of course, there is the big what is called smog and fine particulate matter and everything, that this is more pronounced in the outdoor setting. But then we also have a specific type of air pollution that's indoors, and that's somewhat of a different nature than the outdoor air pollution. And Jessica Lewis from the WHO, she's an expert actually more on indoor air pollution, and I wanted to use this opportunity to also to see what is the difference between those two types of pollution.
Sure. So you're quite right that when we talk about the health impacts of air pollution, often we are talking about all air pollution, which includes outdoor sources of air pollution, and those are, in many contexts, urban air pollution, but they can be from transport or industries, road dust, any outdoor sources, and that's a different category than indoor, or what we sometimes call household air pollution. And these are sources of pollution that arise within a household or a home. In many contexts, and in one that I work in most closely, we're talking about household energy use and sources of combustion, but there are other sources of indoor or household air pollution, which include molds or radon, etc. And so indoor and outdoor air pollution together make up the larger problem of air pollution and its impact on health. And to dive a little deeper into indoor air pollution from household energy use, since this is estimated to be the 4th greatest risk factor contributing to premature death and the largest environmental risk factor for health. Household air pollution is generated from polluting use of fuels for cooking, heating, and lighting. And at the WHO, we spend a lot of time thinking about that and how to both record the state of indoor air pollution and household air pollution. And so going back to what we were talking about with gathering better data, there's a lack of data, and we do maintain a database of national level data for this problem, and that enables us to do things like compare household energy use in urban and rural settings, where we see that in the rural settings, there's a much greater use of polluting fuels, leading to much higher levels of air pollution in homes, for example. So I'll let you carry it on, but happy to answer more questions.
Okay, is that, do you feel that indoor air pollution is somewhat getting neglected with all this focus on, it's very easy to get a catchy picture of a skyline with a lot of fog and a lot of mist in front of it, and then write world's most polluted city in front of it, but then to make to publish a picture of like a wood cooking stove somewhere in a rural area is maybe just not as telling. Is the problem of indoor air pollution maybe underestimated?
Yes, I think you're right, and part of that is that the people who are living in rural areas with very high pollution that is killing much larger numbers of them have a smaller voice and a smaller presence in the conversation. And that's why it's important to include them and to continue to focus on air pollution, including the toll that it takes from household energy use.
Okay. Yeah, thank you very much. I think that that this is interesting and important to understand for all of us. That the air pollution doesn't start outside, but it comes from so many sources.
Yes, and sorry, just one more thing, if you don't mind, for me to add to that. I do, however, think of them as very interlinking problems. So pollution from indoors. If you've spent any time in a rural village where they cook and the smoke just exits through the roof, becomes outdoor air pollution. And similarly, if you are cooking with clean fuels living in a polluted city, you may still have very high levels of indoor air pollution from the outdoor pollution coming in. So I don't think we should work at this problem by considering two completely distinct things. Both of the problems should be considered together.
Okay. But then when we say, is there a way to directly monitor kind of air pollution in a way without heavy sensor or tech equipment? Maybe to all the doctors of you, like how, because the real problem is when we kind of monitor air quality, we don't feel it until it's too late. You start to feel it when you become asthmatic or when you what is the some of the first warning signs when we talk about our bodies as kind of the tool to monitor. I think that this is something interesting for a lot of people. Can you say the doctors amongst you, like Thiago, can you say something about that? When do we have to start worrying and looking at the air quality data and improve something?
Well, my understanding on this is that we have to advance quite a lot on the data we have available, particularly because we have to look at all the differences we have on air pollution within cities. So we should try to go deeper into data details within cities as well. And another relevant aspect is that the background concentration is not everything. We change our inhaled dose, we change our exposure based on our daily practices. And I say practices and not behavior because I tend to accept the fact that for most people these are not options. Like in the vast majority of people walking and cycling in the world, they don't do this because they want to, but they do this because there's no other option, no other better option for them to commute. Interestingly, in most cities in the world, despite the fact that our air pollution is bad for you, it's still worth to walk and cycle in the city. So it is a good trade-off because we have people out there, either because of poverty or because of personal beliefs and choices they make in their daily living, changing air pollution levels by changing, for instance, the way they commute. And at the same time, they're still getting health benefits. Yes. I think we should, back to your question, I think we should worry about the data and monitoring always, even in clean places, because we have to know what's happening before acting.
Mm-hmm. Yeah, you recently published a paper, right, on exactly that subject, that basically looked at people commuting motorized and people commuting non-motorized, and then how the health benefits compared to also commuting actively but in a polluted environment.
Yes, we know that we gain from the physical activity related to walking and cycling or any other active form of transportation, rowing, horse riding, but we also lose because of air pollution levels. The question is, what's the net benefit? Do we have a net benefit even in highly polluted cities? And at least for chronic benefits for the general population, the answer is yes, which is something good for all of us. But it's still, like, what I really liked about David's app is the fact that you empower people to make the decisions on an informed manner. And if you look at the discussions at the Habitat 3 preparation documents and meetings, we have like clearly the principle of the right to the city, which is not just the right to access the city, but it's also the right to transform the city, the places we live in. And to transform the cities in an informed manner, we need to build tools for people to be aware of the situation. So this, our study, David's apps, and many other initiatives are just bits that allow people to make an informed transformation of their own reality.
I have another question for Nandita. Where do you see this role of citizens as change agent in the international, because now this year we are formulating, or at the moment a lot of organizations are advocating for getting this United Nations new urban agenda right, or getting getting it more streamlined, more implementation focused, more applicable to create the real change that we need. Where do you see civic engagement when it comes to improving the urban health, and specifically when it comes to air pollution? Is there a good foundation? You mentioned before that in the SDGs health is stated, then of course also in the new urban agenda health is stated in some places. So how does that play out? So we had the small scale agenda for us as citizens. Of course, we need the good data. We want health in our cities, in our daily lives. But where does it come in from a large scale policy point of view?
Okay. For the purpose of this discussion, I'm going to make a distinction between citizens and civil society organizations. Both have a critical role to play, different roles, but both critical. Both have a stake in the issues at hand. They will be impacted by it, and they need to be a participant in any solution. Therefore, without saying they're both critical. It's really interesting and good to see the increasing recognition of the role of citizens as actors in communities and their participation as being required in formal processes, as well as seeing civil society increasingly having a voice in the discussion. So in both cases, I think there's great value. As far as civil society organizations go and the international policy frameworks go, I think one of the advantages we have and that we bring to the table is, first of all, we work across multiple sectors, and we have the flexibility and the independence to do so. Hence, if we work in tobacco control, say, or road safety, we've now learned to work not just with health departments, but with all the other departments that are so critical to be in the engagement process to get the healthy outcome. So we understand the dynamics of that. We know how to work with the multiple sectors. I mean, we know how to see health as really being something in all policies. So I think that's a strength civil society brings with it. The other is civil society can play a very supportive role in monitoring and accountability. Again, whether it's through shadow reporting or through other forms of monitoring, I think civil society has a critical role to play, both in terms of feeding information back to governments that seek to do good or maybe not, and in helping strengthen the system by providing the meaningful information. How citizens can be engaged is a separate question. Would you like me to address that now or later?
I think we should, I would like to hear it now. If you can answer it now, that's fine.
Sure. Okay. I think citizens are a critical part, but I will step back a little bit as a behavioral scientist and go back to sort of the theory. And the theory of communication and change is as follows. If we want people to change and to move down a certain path, we need to be strategic in our thinking and know that there are certain key principles that need to be available and in place for that to happen. So first of all, we need the information. And that information comes from whether it's government monitoring, monitoring from apps like Plume, public advisories, and most critically reports like the ones that WHO has produced that really make the case for the issue, that describe the problem and the health burden of it. So that is critical. But we know that that's not enough. We think about people driving cars without seatbelts on, or drinking and driving, or smoking. People know that certain behaviors are risky, but they engage in them. The reason they engage in them is because there is a psychological process by which they're not attending to that risk. So they've put the risk away into the future, they've minimized it for themselves, they've said, it's not going to happen to me, I'm somehow a better driver, so I'm safe, whereas others are not. Or they may poke holes in the data, like, well, tobacco, is it really that harmful, and air pollution, is it really that bad? So for us to really see civic engagement and movement, we need to make the case that that risk is real, it's imminent, and it's personal. It can happen to you. And the third element to that then is there is a solution. So once you've created risk in a population, they must have some place to go with it, some place to act with it. And that is really, from a public policy standpoint, a really critical piece in the puzzle. I'll give you an example of that. So India, as you know, has been a hotbed of discussion on air pollution, and there's been a lot of media reporting, particularly around the WHO reports on how Delhi has been named the most polluted capital in the world, so forth. It's been brilliant in terms of getting people talking, policymakers actually attending to the issue. In collaboration with WHO Siri, we did a 2-year content analysis of news media reporting to see what is the media really talking about. The media is brilliant at setting the agenda. They're a critical actor in public policy making. So what is it that they're saying? And what we found through the systematic analysis is, one, they are describing the problem. 2, they are raising that risk perception, what we need in communication to trigger change. But there were a lot of gaps. One, they're not talking about the large range of problems that ensue from exposure to air pollution. So they talk about health in general, they talk about mortality, but the burden of disease, particularly some of the non-communicable diseases, are not really mentioned. When you come to sources, a significant bias towards vehicles. And, India is one of the places in the world where household air pollution is a significant burden to health, not just indoor, but also to ambient air pollution, as was just described. It contributes to the air pollution contributes elsewhere. Barely any mention of household air pollution. And in terms of media calling for policy reform, again, all focused on vehicular traffic. So this really makes the case for how, when we're engaging with citizens, we need to be able to present clear information that they can act on, raise the risk, and then ultimately provide for action and the solutions that people can get behind. And when all of that comes together is really when one can expect to see change.
Mm-hmm. Okay, great. For Jessica, do you have experiences from your work at WHO? Maybe not only what you yourself are working on, but also colleagues that an IGO like the WHO, very established, very respected, very data-driven. WHO says nothing that cannot be proved on the health sector, which is really important because you become very trustworthy and an authority in this way. How do you work as an institution with civil society stakeholders, or do you even then work with citizens as well directly? Are there projects where you engage citizens as well? Yes? Okay, you start again.
Okay. You're quite right to say that we do work very hard to ensure that the publications that we make and our positions are backed up by data and expert review groups as well, depending on the project and setting. And in air pollution, a few of the panelists have mentioned a recent database that we released on urban air pollution, for example, and that was compiled from, it contains data, it does contain data from 3,000 cities and presents their air pollution levels, but it was compiled from monitors that are ground level throughout the world, and that involved an extensive consultation with the countries before that data was released, presenting it to them. And so it depends on the work, what level of engagement we make with our stakeholders. By that I mean the WHO member states. And then, for example, another project that we are working on air pollution is designing a new set of surveys which will monitor household energy use as clean and polluting fuels are used in households for cooking, heating, and lighting. And for that, we have been piloting it around the world and have been having partners in academia and private sector as well piloting the survey questions, which will then help provide better data for everyone to use and better increase our state of understanding. So those are a couple examples of across the spectrum how we engage with different stakeholders.
Okay, so as you say, what you can measure can be attempted to get done. So that is also the importance of the monitoring work that we can do. You know that if there would be no measurement of air quality, or in this case often PM 1.5, PM10 or PM 2.5, which are the most important, so the fine particulate matter fractions that are the most important proxies for air quality measurements. Then, if we wouldn't have these measurements around the world, we would never be able to make a list of these, the world's most polluted city, and the city with the worst air quality. I wanted to ask actually Nandita again. I think you briefly mentioned it before. I read this article yesterday which criticized this whole listing of air quality data. Basically the article stated that just throwing out a city because of one measurement and saying this is the worst polluted city in the world, the city with the worst air quality, it doesn't really help a lot to change. I mean, how is that? How was that in the case of Delhi? Did that, basically the whole world, like looking at Delhi as an example of a really bad air quality, a really polluted city, did that help the situation in Delhi to become better, or that people started to do something about it?
Yeah. Well, I mean, I think there's a lot that people need to understand about air pollution. There's a lot more communication we need to do about what exactly air pollution is, what these air quality monitoring systems are, what they provide, and what the link is to health. And I'm often struck by that exposure risk relationship between air pollution and health that I think some in this world of public health know, but that's not more commonly understood. And I think there are others here who can comment on it in greater and better detail. But essentially, this whole vying with one another to claim that we've come down 10 points and now we're better, and we've come down 15 points, we're better, still misses the point when we're averaging at 300. Claiming victories, or cities competing with one another about how they're a notch better than the other. It misses the point totally, because from a health impact point of view, it doesn't quite matter. The reduction has to be far more dramatic before the health of the citizens will actually improve. And so I think the coinage of Delhi as one of the most polluted cities in the world had its effect. The citizens were outraged, the government took notice, it followed through with certain policies. It also coincided with India's desire really to be part of the renewable energy market. So simultaneously, India launched its solar mission, and there's this big push for actually, creating cleaner energies while also addressing the utter energy poverty in the country. So those two sort of coincided and have been working together. But from the point of view of the competition between cities, I think they're often missing the point. And as public health advocates, we need to make that case clearer that 10 points doesn't a winner make.
Mm-hmm. Okay. Do you, Thiago, do you have any experiences like this from Brazil? Like, is there, any bad listing or any helpful or unhelpful comparison when it comes to urban health or air quality?
Not really within Brazil, because we're more or less the same range, all the large capitals. But I absolutely agree with Nandita that this ranking doesn't really address the issue in a proper way, and also not just the ranking of polluted cities, but also ranking the causes of death or the burden, the health burden from different exposures. Like this is not a competition. The situation about air pollution is relevant because, one, it's absolutely avoidable. We're all gonna die. This is not the issue. Sooner or later, we're all gonna die, but some deaths are absolutely avoidable, and this is one. Air pollution doesn't need to be this high, doesn't need to occur. And second, air pollution is a matter of poverty and inequality. So the largest determinants of indoor and outdoor air pollution are not individual. They are social, political, and economical. So tackling air pollution is also tackling poverty and inequality within cities, within countries, and across countries as well, because we know like a lot of industries are polluting in Delhi, where industries that moved to Delhi or to São Paulo because they're not allowed to do these bad practices somewhere else. You see, a lot of people having to burn coal, like pull fuel to heat their houses in the countryside of China or in the countryside of Brazil. They have no other option. So I think we should give a little bit less importance for these rankings and try to focus on the real issue. And the real issue is that air pollution is absolutely avoidable and is a consequence in large extent of the poverty and inequality we face in this world today.
Mm-hmm. Yeah, I think that this is a really, thank you very much for making this point. I think this is really interesting. And there's maybe one question, follow-up question. Isn't it that you could have also not only a ranking of air pollution levels within cities or amongst different cities, between, I don't know, let's say 10 world cities or the 10 most polluted cities. But then if you take one highly polluted city, and then you compare the dose of daily exposure for a certain person, it might be also considerably different, right? If somebody is rich and can afford an air purifier, or live somewhere outside surrounded by a big by a big greenery, as compared to somebody who is of the very poor population of a city and who has to cook with a wood stove and lives next to a frequented street. So maybe those, amongst the city, the difference could even be much larger than in between cities. What do you say to that?
Yeah, absolutely, exactly. In many cities, if you look at London, which is known for being a very rich city, we have a life expectancy within London, which is far lower in some neighborhoods in London that are far lower than in São Paulo or than in poorer regions of the world. So what is more relevant for us is to have a look on how to make a city a safe, pleasant, healthy, good for living for all. And I think this is something to be addressed. As you said, Background concentration is one thing, inhaled dose is another thing. So we may live in one city and have a completely different inhaled dose, which in the end is what is going to harm you. It's not necessarily the background concentration, but the dose you're exposed to. And this relates closely to the behavior or the practice you have on your daily living, but mainly on the social and political situation you face as an individual or a group of people face as a neighborhood or as a community.
I wanted to play it also to David, because David, you are, as far as I can see from your app, you have a huge list of cities across the globe in this app as well. So I have actually this one first question, but then a follow-up question for you. So the first one would be the same like for the others. How do you see this competition among cities to become more or less polluted or cleaner or healthier?
Yeah, I tend to agree on the fact that talking about pollution in a city is, of course, interesting, but is also limited in the fact that it doesn't capture the variability and the complexity of the air pollution in a given city. And one interesting thing to keep in mind for cities in Europe, like London or like Paris, is that we often have we sometimes have in the year, you know, those pollution peaks where the levels will be 2, 3, or 4 times the WHO guidelines, and those pollution peaks will basically be broadcast and talked about in the media and sometimes cause stress. But when you look at the daily exposure, you actually have peaks in the daily lives of many people in Paris who are actually 20 to 30 times the guidelines. For example, in underground stations. And when you look at the main underground station in Paris, we did measurements against a couple of weeks ago, where the PM levels were 20 times the WHO guidelines, and it's a public place, and you have hundreds of thousands of people getting there and going through those places, and they actually breathe an air that is much worse than what we call the New Delhi average background level, if such a thing would exist. And so it's I think it's useful to remind people that when you live in a city, and the different panelists mentioned that, you are not completely powerless confronted to air pollution. You have ways to actually act on your exposure, and the best way to do that is to start to understand what air pollution is, what the different air pollutants are. We talked about PM. There are the other pollutants too, NO2 from diesel fumes, the VOCs inside, and so on. So understanding them, understanding where they come from, and when they are at their highest, and when they are not, are the interesting levers to basically act on that. And so that's the kind of things we want to push through the app by telling someone who wants to go out for a run if going today, tonight, or tomorrow morning would be the best, looking at how background levels will evolve. And tomorrow, if you are actually able to see how the different air pollutants evolve in your home, when you turn on an air purifier, you open your window, or you do cooking or so on, and when you start to see the link between your activities and what you breathe, you will probably be able to have power again on what you breathe. And I think getting back to this competition and those rankings, one of the benefits would be that they highlight an issue, that they are useful tools to show the issue and talk about the issue with the public in general, and then lead them probably to solutions and to apps and information and ways to protect oneself.
Mm-hmm. Okay, thank you very much. We are nearing the closing of this discussion. Thank you very much. It has been bringing up some very interesting points, I think. Do you have any things that you want to add to at this point? Just freely, without me asking you about something or guiding you into a certain direction? Because otherwise, I think that I will ask the round like one final question that you can answer, each of you. Where do you see like where do you see the biggest potential or interesting potentials from your background and from your perspective to create new projects and innovations that can, on one hand, provide us with the right data, but then also create momentum to raise the responsibility of decision makers and politicians, but then also underline the transformation to future urban conditions, but also rural conditions that are more healthy and where people are more aware that actually their daily consumption of energy and whatever other resources is also, it comes basically full circle from first being, I don't know, first using certain things, but then also you're actually also then confronted with the pollution that they cause. So where do you see the biggest potentials for future innovative projects where also citizens and civil society stakeholders can participate? Is there somebody of you who wants to jump forward with that, or otherwise we'll make a geographical rundown? Nandita, you want to say something?
Sure.
You want to start?
I'm happy to. Well, I think from a public policy standpoint, I'm very excited by the idea of co-benefits. The idea that we can look at these multiple movements, simultaneous movements, whether it's in urbanization, work around food policy, work around transportation, and environmental health, amongst just to name a few, and find those synergies in all of these movements and capture the benefits of certain policies. And I think if we think in that perspective, we serve health in the best way possible and meet multiple goals. So that to me is exciting, and an exciting opportunity, as well as it is one place where I think we have work to do in articulating better how governments can use co-benefits and a co-benefit approach to implement programs and finance and govern those programs as well.
Mm-hmm. Okay, thank you. The co-benefits is also something that that is increasingly talked on in the new urban agenda discourse. That basically only the subject of health in itself, it provides a very interesting viewpoint to basically be able to quantify those co-benefits, or then from the focus of health or urban health, you can then stream out in a lot of different sectors, and then also build the change or instigate projects that raise urban health. But health as such is the only cross-cutting, cross-sectorial concept that can grasp those co-benefits, I think. Maybe to Brazil, Thiago, what are some innovative ideas, or what would you see as important to focus on or work more on?
Well, I follow Nandita on the co-benefits, and if I may add, we have to reflect and act more based on what's supposed to be the business of cities, which is to provide a better quality of life for all of us living in those areas. Also to raise awareness of the peri-urban relations, and to bring those two words together more closely, because the challenges are interlinked, and we cannot talk any longer about urban or rural environments in isolation. And finally, I hope the new urban agenda maintains what's been discussed previously, that is to facilitate and enable citizens and citadins, those living in their own realities, to transform it according to what they wish for the future.
Mm-hmm. Yeah, we are trying to work on this. We are trying to lobby for this since a few months, and let's see. We also with the Low Carbon City Forum, we are aiming to participate in the discussion and then be on the ground in Quito. So we are very much looking forward. But also with our work with the Low Carbon City Ambassador Network, and so we are willing to create our own agenda or the agenda that is instigated by us as a collective, as a civil society organization, and we'll support all of this work. So we are very happy about this framework, but of course we should not wait for it or be limited by it, kind of. David, maybe we come to you as next station. You are you founded this company where you create an app, but I think you didn't say anything yet on these variables. What you want to create, like small sensors. So it sounds like a lot of innovation going on there. Could you see where you see the most promising future developments?
Yes, exactly. It's actually quite a challenge to be able to measure air pollution in a wearable and tiny form factor due to the nature of the type of pollutants we want to measure. So it's actually a development we've been working on with public research for a few years now. And we've been able to demonstrate those prototypes in London a few months ago. And they were actually so tiny that they fit in small backpacks that we put on the backs of birds, of pigeons that basically flew over London and measured pollution in the air over London. So this was obviously a short experiment we did for a few days, mostly to show the kind of technology and the size of the technology we were working on. In the end, we don't want to equip animals, it's rather humans we're interested in. But it's for us the first step, and in the autumn we will be equipping a little over 100 people in London. So from the general public, people who are interested in the topic will basically have one of those sensors. They will measure the different pollutants they are being exposed to throughout the day, indoor, outdoor, have their app to see the way the pollution evolves. And this will be a very interesting first test experiment to see, of course, both what people actually breathe, beyond those background levels that we measure, what the actual exposure is, and this will be something quite new to be able to see that and track that, and then also try and see from a behavioral standpoint how we can basically inform people and nudge people towards habits, towards ways of life that help them reduce their exposure to air pollution and reduce their doses. And on all those aspects, I guess it will be a very interesting experiment in the autumn, and then I hope we'll be able to show to the public and more and in the open and on a broader scale the technology and make it available to the public worldwide.
Mm-hmm. Yeah, that sounds very exciting. We're looking forward to be updated, and we of course we spread the word if there is any results on these projects and experiments. So Jessica, from the side of you personally and also your organization, what are the things that you are looking forward to see and what you would like to see in the future, in the next months and few years?
Sure. Well, it's great to get such a diverse group together talking about these things, because I do think that there are very important roles for actors in civil society and non-governmental organizations, academia, and innovation partners. So I'll speak to some innovations that I think are coming out in the form of or that I would like to see happening from governments, which I think is another area that is instrumental to see large change. And the WHO is working with our departments, ministries of health to develop clean air action plans for each country. And so I see a vision of having governments take action to address urban as well as household air pollution by using, so for example, we write a catalog of methods at WHO which provides guidance for governments on how to develop interventions to address these problems and then follow through with them on that. So I think empowering governments to also tackle these problems is an area that we'll see a lot more movement on, and that I think could really help shape the future of air pollution, hopefully.
Okay. From our side, I think it's also about creating awareness and the right images. We will keep on working on this, and also bringing together the right people like today, or new sets of people. I hope you enjoyed the conversation as much as me. I think we ran like 5 minutes plus. Is there any concluding remarks that you want to add? I'm always asking an open question in the end. Okay, because I think we have gotten some good ideas, and the right stakeholders are also available. I think it would be interesting for us in the future. We will be thinking who we can bring together. Yes, thanks to all the speakers today. So we had Nandita Murukutla from Vital Strategies. We had Jessica Lewis from the World Health Organization. We had Thiago from the University of Sao Paulo, and David Lissmyr from the Plume Labs. So thank you all very much for attending, and yes, keep up your work. I think this is very important what all of you do, and if you want to share the video, it's all on our YouTube channel. It's on the Low Carbon City TV channel on YouTube. You can follow the Twitter coverage. There was some tweeting going on with the hashtag LCCFTV, and also, of course, look forward to some future hangouts. And also, everybody of you and everybody who is interested in like building the change that we need is welcome to the Low Carbon City Forum that will take place this autumn from 10 to 12 of October in Medellin in Colombia. As mentioned, we expect around 3,000 participants. We are very busy at the moment producing the program. We just closed our call for proposals, where we received close to 200 proposals for the program from around the world. We have first speakers confirmed. So follow us on our website also on www.lowcarbon.city. And yes, we are happy to stay in contact and see you at the next hangout. So thank you very much.
Thank you.
Thanks.